Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the presentation on managing dental patients with blood disorders. In this session, we will cover one of the two types of blood disorders, that is coagulopathy and therapeutic anticoagulation. Therapeutic anticoagulation will be discussed in the next video. We will focus on essential steps and precautions for handling surgical cases involving patients with coagulopathies. Ensuring patient safety and successful surgical outcomes is crucial. We will discuss why understanding these conditions is important and outline the key precautions and treatment necessary for providing safe and effective dental care. Let's start with hereditary coagulopathies. Hereditary coagulopathies are genetic disorders that affect the blood's ability to clot properly. These conditions can lead to excessive bleeding or, in some cases, an increased risk of thrombosis. The most common hereditary coagulopathies include hemophilia A, B, C, or von Willebrand disease. Patients with inherited bleeding disorders often know about their condition, but sometimes prolonged bleeding after dental procedure is the first clue. It is important to ask patients about their history of nose bleeds, etc. To diagnose bleeding disorders, we use specific laboratory tests. Prothrombin tests the extrinsic pathway factors, while partial thromboplastin time detects intrinsic pathway factors. The international normalized ratio helps standardize PT values to ensure consistency across different laboratories. Easy bruising can indicate platelet inadequacy. This is evaluated through bleeding time and platelet count tests. If a bleeding disorder is suspected, it is important to consult with the primary care physician or hematologist for more detailed testing and management. Managing patients with coagulopathies during oral surgery depends on the specific bleeding disorder. For deficiencies like hemophilia A, B, C, or von Willebrand disease, we use factor concentrates of desmopressin. Antifibrinolytic agents such as aminocaproic acid also help manage bleeding. For quantitative platelet deficiencies, if the platelet count is between 20,000 to 50,000 per cubic millimeter, the hematologist may wait to see if post-operative bleeding becomes an issue before giving a transfusion. If the count is below 20,000 per cubic millimeter, a transfusion before surgery or a delay in surgery is necessary to ensure patient safety. Qualitative platelet disorders are often due to medications like aspirin or clopidogrel, or problem with the liver or spleen. It is important to consider modifying the medication regimen to manage these disorders. Even if platelet counts are higher than 50,000 per cubic millimeter, transfusions may be needed if there are concurrent qualitative issues. For patients with bleeding disorders, use local infiltration for anesthesia to minimize the risk of damaging larger blood vessels and causing prolonged bleeding. Topical coagulation promoting substances can help with clotting in oral wounds. Additionally, it is important to instruct patients on how to avoid dislodging blood clots after the treatment. Now we will go through the guidelines for the management of patient with a coagulopathy. This box outlines the management steps for patients with coagulopathies. These guidelines are provided in your textbook. Now let's explain these guidelines one by one. That will be the revision of the previous slides. Before performing any surgery on a patient with a coagulopathy, it is vital to consult a hematologist. They will provide specialized advice on managing the patient's condition. Additionally, baseline coagulation tests such as prothrombin time, partial thromboplastin time, bleeding time, and platelet count should be performed. Screening for hepatitis is also necessary to prevent complications during and after the surgery. To minimize bleeding risks, schedule the surgery immediately after taking measures to correct coagulation. might include platelet transfusion, factors replacement, or administering aminocaproic acid. During surgery, I use substances that promote clotting, sutures, and pressure packs to help control bleeding. After surgery, monitor the wound for at least 2 hours to ensure that a stable initial clot forms. It is important to instruct the patient on how to prevent the clot from becoming dislodged and what steps to take if bleeding starts again. Avoid prescribing non-steroidal anti-inflammatory drugs to these patients as they can interfere with clotting. Additionally, take all necessary precautions to prevent the transmission of hepatitis during the surgical procedure. Patients with severe coagulopathies requiring major surgery should be hospitalized. This allows for close monitoring and immediate intervention if complications arise. The guidelines and steps for management of a patient with a coagulopathy are summarized here. To conclude, managing dental patients with blood disorders involves understanding their medical history, conducting the necessary lab tests, collaborating with the healthcare professionals, and planning surgeries carefully. Patient education on post-operative care is also crucial for successful outcomes. Thank you. Wish you best of luck.